If you've been told you have a short leg and need a foot lift, it's important to understand that not every leg length difference is structural, and not every situation requires correction with a lift. Many people are labeled with a leg length difference based on symptoms or how they appear in a single position, often lying on their stomach or on their back on an exam table, without determining whether the difference is truly anatomical or if it's being created by a functional alignment pattern. In this video, we'll help you understand when a true structural leg length discrepancy is present and when the appearance of a short leg is being created by functional patterns. You'll see how leg length is evaluated by observing consistent alignment patterns rather than relying on symptoms alone, and how structural leg length differences are distinguished from functional alignment patterns, and the step-by-step process I use to determine whether a foot lift is actually necessary, what an appropriate lift height looks like, and how the correction is applied. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years experience and a background in gait analysis, biomechanics, and neurology. My mission is to provide a thorough solution to spinal problems that develop from an unlevel foundation, like anatomical short leg, spinal and pelvic misalignments, poor posture, and foot dysfunction. This channel is for people dealing with chronic pain, like back pain, sciatica, neck pain, poor posture, or headaches, and are looking for real lasting relief. You'll get clear step-by-step strategies to address the root cause of these conditions and start feeling better fast. Subscribe now for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms, so you know exactly what to do next. I upload a new video every week. When people hear the term leg length discrepancy or leg length difference, most people immediately think uneven hips, a limp, or a feeling that one leg is shorter when they walk. And that assumption makes sense. Those are things people notice. But none of those on their own actually define a true leg length difference. A true leg length discrepancy is structural. That means the bones of one leg are generally shorter than the bones on the other. Not sometimes, or not when you're only tired or in certain positions. It's present all the time, regardless of how you stand, sit, or move. This consistency is the key. Structural differences don't change with posture or movement. If the appearance of leg length changes when you shift position, adjust your stance, or alter your alignment, that strongly suggests the leg length itself is not the primary issue. Something else is influencing how the body's organizing itself. This is also where a lot of confusion begins. Functional alignment patterns can create very convincing signs: pain, visible asymmetry, uneven loading, even the clear appearance of a short leg. But the symptoms don't tell us why something is happening, they only tell us that something is off. Once you understand that distinction, it becomes much easier to see why so many people are given foot lifts that don't actually match what their body needs. And that leads directly to the next question. If it's not always structural, what kinds of patterns can make a leg look short when it really isn't? This is where a lot of people get misled, because the body doesn't have to be structurally uneven to look uneven. You can have two legs that are the same length and still present with what looks like a shorter leg, simply because of how the body is organizing itself. Simple functional patterns can do this. Think about someone who consistently stands with more weight on one side, such as a factory worker or cashier, or someone who spends most of the day slightly bent forward at a desk or commuting in a car. Over time, the pelvis can rotate, tilt, and when that person stands up, one side appears lower than the other. It even feels real, it might even look real, but nothing about the actual bone length has changed. Lateral bending patterns can create the same illusion. The trunk shifts from one side to the other and takes on more load, and alignment changes from the feet all the way up through the spine. In more pronounced cases, the torso can even translate off-center, which exaggerates the appearance of a short leg even further. There's another important piece here that often gets missed: structural distortions in the spine that we refer to as spinal misalignment. They can trigger signals to the brain that something is imbalanced. In response, the nervous system creates a corrective strategy. Muscles tighten and protect and stabilize. Muscle contraction often shows up along the entire muscular chain, and when someone is lying face down on an exam table, it can present very clearly as a short leg. This is a functional response, though, not a structural difference. And the key clue is that it can change. Improve alignment, alter position, reduce the distortion, and the apparent leg length often changes. That's fundamentally different from a true structural leg length discrepancy. And this is why the next step matters so much. Before deciding on our foot lift, we have to determine whether what we're seeing is a consistent structural difference or functional pattern driven by alignment and neuromuscular response. That's where proper assessment replaces assumption, And that's exactly what we'll look at next. So we've explained the difference between the functional short leg and the structural short leg. The pictures we're going to show first are of a functional short leg. These were taken with a patient lying face down on the table. We look straight down on both feet. You can see one leg actually looks like it's pulled short. In this case, it was an alignment issue in the pelvis. With some adjustments, it would level right out or come close to leveling out and get back to balance. So that's a functional short leg. When they return for a further visit, you'll see that not too much has returned, so the leg length is almost balanced. Occasionally it will pull short again based on the patterns that they show up with, but that's a functional short leg. Doesn't require a lift. In this case, we're going to actually show you a young fella that we saw that actually had a structural short leg. So his ended up being a 9 millimeter difference, probably greater than 9 millimeters, but we corrected it with a 9 millimeter lift on the left-hand side, which brought him back to level. So we'll show you those pictures in a couple of minutes. But in his case, the way we went through it initially was we start with a good health history. The health history really gives a good indication of what you're dealing with. In his case, he's 14 years old. His mother noted a 10-year history, roughly, of chronic low back and leg pain, both through the day, sometimes at night. He had many issues. One of those things that their parents are often told with kids, they were called growing pains. But it wasn't a growing pain per se. He had an imbalance that his muscles were trying to compensate for. And essentially when he would get running or more active with his friends, either at school or at home, he would just find that he would really suffer for it afterwards. So he'd gone through this for a number of years. When he came into us, we did the history. What's one of the questions we asked about or dug into a little bit more, and that's what we found out. After the history and after we did all that, the second thing we went into was the examination. Now, the neat thing about an examination in someone with a short leg is that when you look at the patterns, one of the biggest things you'll see in somebody who doesn't have a short leg, alignments in the spine may be off, but it's generally segmental, so it's in smaller areas in the spine. When somebody has an anatomical short leg, one of the big things you'll see is a big block of the spine will have a change. You can see on the x-ray here that we had done, there's a curvature in the spine and an unleveling in the pelvis. When the body tries to adapt to that, you'll see big muscle blocks locking up to try and hold that. That's one of the reasons why when he would run around and play, those muscles would just get so fatigued and so sore and cause him problems later. But on the examination, that's one of the things you'll see big patterns versus small segmental issues. After that, we did the posture assessment. On the posture assessment, as you'll see, standing posture from the back, this young fella translated off to the left-hand side pretty significantly. So the plumb line runs straight up and down. He should be equally divided on that. He's leaning pretty significantly to the left. So in his case, once we've done all these and once we did the x-rays and looked at all this, the determination was he most likely did have a structural short leg. But the other thing I like to do is start with a little bit of care. So in his case, we did some spinal adjustments, we did some stretches, and we did some home exercises. And with that, what we were finding in the first few weeks was that with the adjustments, he wouldn't really hold the adjustments well. He would come back in and pretty much be right back to the same pattern he had before. Even though the spine was actually moving a little better segmentally, the whole pattern wasn't changing dramatically. So we started looking into more, we're going to have to correct this with an actual structural lift. So what we did after a few weeks was we put him back on the posture unit. And as you'll see here, his original picture shows him translating off to the left. We would put different height lifts under the left foot to bring him up. And you can see that when we've settled on 9 millimeters, that's what brought him right back to the midline. So it corrected the righting reflex, brought him right back. You know, he even noted after we did that felt the most comfortable of all the heights we used. But that was really what he needed, was that structural lift. So then in his case, we sent him off to a lab that does all the corrections for us in town here. They took a few pairs of his shoes. They added the lift, as you can see in the pictures. And basically what they did was run a full-length lift from the heel right to the balls of the feet with a slight taper at the front. And what that does is, again, keeps him fully level. So it brings that whole earth up to that foot to get his legs into an even balance and get his head back to the midline so he can function like a normal person. So the big takeaway is this: a foot lift isn't something you start with. It's something you arrive at after consistent patterns are clearly identified and confirmed. Pain, unevenness, or the feeling that one side is off doesn't automatically mean there's a structural short leg that needs to be corrected. If the appearance of leg length changes with posture, movement, or position, that's meaningful information. It tells you the body may be adapting through functional patterns rather than compensating for a true anatomical difference. And when a structural leg length discrepancy is present, the correct lift should feel stabilizing and supportive, not aggressive or forced. The goal isn't perfect symmetry, it's better balance, easier movement, and less strain through the spine and pelvis. When that distinction is understood, decisions about leg length correction become much clearer. Take a moment to think about what you're noticing in your own posture patterns and get a thorough checkup with a qualified health practitioner. If you're dealing with low back pain, the next video you should watch is this one, where I explain why leg length discrepancy matters specifically in low back pain patients and how it influences spinal loading and alignment.